This is GJ. We will call her Grandma Janice. She's a 71-year-old overweight woman with osteoarthritis, hypertension, high cholesterol, and type 2 diabetes.
Osteoarthritis is a type of inflammation in joints that can occur in the hips, spine, hands, and knees. It is when the cartilage on the end of the bones are getting gradually worn out. OA often leads to crepitus and osteophytes. OA occurs due to an imbalance between the production and the breakdown of cartilage, causing lesions to appear. The cartilage will try to repair these lesions, but will gradually become incapable of compensating for the imbalance. The thickness of the cartilage diminishes, leading to narrow joint space. A bony proliferation may occur, pushing the cartilage towards the outside of the joint and leading to the appearance of osteophytes. The deterioration of the cartilage releases substances in the joint which irritate the synovial membrane. Common symptoms include pain and stiffness in joints, limited range of motion, and clicking, cracking, and grinding when the joint bends. They feel tenderness on joints from various types of movement. OA patients also have a loss in flexibility and lower back pains with occasional shooting pains from the lower back to the thigh. They experience deep, aching pain on the anterior tibia, extending to the ankles and toes. They also feel hard lumps, which are also known as bone spurs, at the interphalangeal joints.
There are several conditions which predispose a patient to development of osteoarthritis: age, gender, previous joint injury, obesity, low bone marrow density, and ethnicity. The occurrence of other diseases in conjunction with OA greatly impacts treatment and management. Common comorbidities in osteoarthritis patients include hypertension, depression, COPD, epilepsy, obesity, diabetes, metabolic syndrome, and cardiovascular disease. Grandma Janice suffers from obesity, hypertension, and type 2 diabetes. Prevalence of these comorbidities are high among patients diagnosed with OA. Unfortunately, pain secondary to osteoarthritis may advance development of comorbidities due to lack of movement. In the cases and treatment of rehabilitation, exercise is not only beneficial to management of a patient's OA, but compounding chronic comorbidities as well.
Grandma Janice claims to already exercise regularly. After gaining 20 pounds this past summer, she claims to be in increased pain. NSAIDs only gave her mild relief, so oxycodone was prescribed, but Grandma began showing an increased intolerance and was maxed out on pain meds. Our recommendation is to continue to exercise regularly, but to actively attempt to lose weight by increasing the time spent and/or the intensity of the exercises in the pool. We recommend that she swim laps for 15 minutes, then to participate in an aquatics aerobics class for at least 30 minutes, and do that at least 5 days a week. Grandma can also use dumbbells and do upper body exercises such as overhead press and curls for 2 sets of 10 reps.
Avoid inflammatory foods such as sugar and salt, which can worsen joint inflammation. Avoid high-impact aerobics, such as running and jogging. Don't skip the warm-up and avoid jerky movements. Don't take excess pain medication prior to exercise, which can cause you to over-exercise. Don't exercise on uneven surfaces. Gentle stretching is important. However, be cautious of hyperflexibility of joints. Avoid any kind of exercise if you have noticeably increased swelling, sharp pain, pain that causes a change in gait, or joints that are red or warm to the touch. Osteoarthritis is a leading cause of disability among older adults. As the majority of our population ages, it is a growing concern. Much of the U.S. population is sedentary and doesn't get proper exercise. The health of our nation is very low compared to many other countries, and many aren't getting proper nutrition. An estimated 160 million Americans are either obese or overweight, which can lead to osteoarthritis. Many individuals with osteoarthritis are unable to work, and earning losses cost an estimated $81 billion per year. By 2040, the number of adults with arthritis is projected to increase to 78.4 million, most of whom will have osteoarthritis.
Osteoarthritis is a type of swelling of the joints of the hands, hips, knees, and/or spine. The cartilage breaks down, which can lead to bone-on-bone grinding, causing pain. It is commonly seen with obesity and hypertension and can be treated with exercise and pain medications.